Whereas there were very few differences between the people that derived benefit from the psilocybin treatment and those did not, along the dimensions of synesthesia, this blending of different perceptions that ordinarily doesn't occur for most people, or complex imagery, right? Put simply, everyone who took psilocybin in this study at 25 milligrams saw complex imagery. They saw a lot of hallucinations, but just seeing hallucinations did not lead to the positive clinical outcomes in terms of mood. Anxiety was a very interesting measure here because ordinarily we think of the ego dissolution, the letting go, as such a key component of the psychedelic journey in terms of the positive therapeutic outcomes. This has been discussed quite a lot. And in full disclosure, Robin Carteret-Harris has already come on to record an episode of the Huberman Lab podcast. That episode hasn't been released yet, but it will be released soon. And he talks about the importance of this letting go in terms of the positive clinical outcomes of the psilocybin journey. And indeed, that is true. And I should also mention that Dr. Matthew Johnson from Johns Hopkins, who also runs a laboratory exploring psychedelics and their role in treating things like eating disorders and depression, et cetera, also doing incredible work, also talked about the importance of letting go during the psilocybin journey, this ego dissolution, this ability to move through the anxiety. And again, I can't underscore this enough because it's been told to me over and over again by the top researchers in this area that people will head into that peaking phase of the psilocybin journey, and oftentimes it is not pleasant for them. They're feeling like it's uncomfortable, it's scary, and their heart rate is up, and their blood pressure is up, and they're having a hard time calming down than they want to calm down. But it does seem that while the guides should not ramp them up and get them more stressed, that the ability to move through that stressful period, to somewhat guide oneself, or to be encouraged to guide oneself through that peak, and that anxiety and the fear of losing oneself and the so-called ego dissolution that occurs, is an important feature for an effective therapeutic session. In this study, anxiety itself was inversely correlated with a positive therapeutic outcome. Okay, so this is important and somewhat nuanced. On the one hand, I'm telling you that the letting go, the ego dissolution, does seem to be important in terms of reporting a psychedelic experience as effective, as having accomplished something, and perhaps even explaining some of the long-term positive effects to emerge from that psychedelic journey, in this case, psilocybin journey. However, non-responders, that is, people who did psilocybin but did not have a positive therapeutic outcome in comparison to the responders, those non-responders tended to have higher subjective ratings of anxiety than did the responders. So this is important. And what it speaks to is the fact that, well, yes, letting go during the session, experiencing some anxiety, perhaps even ego dissolution and the dissolving of self and then the return of self is important. It is also important, it seems, that anxiety not be so high or subjectively experienced as so high that one does not experience the positive neuronal rewiring that leads to a more pervasive, elevated mood. Okay, so I'm definitely saying two things at once because I'm trying to capture the data accurately. It would not be fair for me to say, just let go, experience as much anxiety as is possible, and that's part of the process. Yes, letting go, again in air quotes, seems to be important for one's experience of the psychedelic journey, in particular around the peak that occurs about 2 hours in or so. However, extreme levels of anxiety seem inversely correlated, or negatively correlated would be the better way to put it, with the positive therapeutic outcome or relief from depression. So this takes us back to all of the things we've been talking about thus far, not just the chemistry and biological action of psilocybin, but the key importance of getting dosage right, the key importance of making sure that you're in a safe environment, but also one in which the guides really know what they're doing. I think this is one of the biggest and most important reasons for having well-trained guides who really understand the contour of the psychedelic journey, but are also trained in how to help somebody with their anxiety in real time while they're under the effects of psilocybin. And of course, to help people integrate those feelings of high anxiety and maybe guide them back down to a calmer state during the psychedelic session itself. And here I can just mention some unpublished data and studies. And again, these are very preliminary, but through discussions with Dr. Matthew Johnson, who's running these psilocybin and other sorts of psychedelic trials at Johns Hopkins, he and I discussed the importance of having a real-time tool to adjust anxiety while under the influence of psychedelics like psilocybin. And there he asked, and they've started to incorporate, is my understanding, some of the real-time respiration tools, that is, breathing tools that we know, based on work in my laboratory, Dr. David Spiegel's laboratory, can reduce anxiety very quickly in real time. And that involves the use of the so-called physiological sigh. I've talked a lot about this before on previous podcasts. So rather than explain it to you again here now, we'll put a link to the physiological sigh. I do a demonstration of it in the show note captions. I'll also link to a recent paper that we published in Cell Reports Medicine. This was a collaborative work that my laboratory did with Dr. David Spiegel's laboratory at Stanford School of Medicine, showing that the physiological sigh is among the different deliberate respiration techniques, one of the fastest and most effective ways to reduce levels of autonomic arousal, aka anxiety or stress. And Dr. Matthew Johnson's laboratory has started to incorporate physiological sighs within these psychedelic sessions as a tool that the guides can refer people to before the session begins, teaching it to them so they realize they can calm themselves down if necessary in real time. It works the first time, it works every time. This is not because it's some magic breathing technique that I created. It certainly is not. This is a naturally occurring pattern of breathing that occurs in sleep and in waking, but that when done deliberately leads to very rapid and quite significant decreases in stress and anxiety. And then when people are inside of the psychedelic session, if they feel their anxiety levels are going too high, they're heading toward what might be called a quote unquote bad trip. They're starting to panic or really think they're going to have a panic attack or die. Again, the subjective experience is going to be layered on top of the physiological experience of one's heart rate being really elevated. So a lot of stress and agitation. By using the physiological sigh inside of the psychedelic session, Dr. Johnson's laboratory, and I believe at least one other laboratory, are starting to use breathing techniques such as the physiological sigh as a way for these people who are under the influence of psilocybin to self-direct their own calm and to bring that level of anxiety down so that they can continue to move through the peak and move through the other phases of the psychedelic journey in ways that can be most beneficial for them. So to close out the description of this really wonderful study, and by the way, it's another one from the Carhart-Harris Laboratory, about the subjective experience of ego dissolution or oceanic boundlessness, this mystical state, as so key as a component of a positive psilocybin journey. I'll just read for you the final sentence of this paper because it captures it so well. Quote, "It seems vital that appropriate consideration is paid to the importance of promoting a certain kind of experience, as the quality of that experience may be the critical determinant of therapeutic success."